first question is, being a dental specialist, while practicing dentistry, what were a few of the misconceptions you came across that people had in regards to oral health? In your role, how did you address them and dealt with those?
Right. So the first and foremost was that people were not very careful about their oral health. They thought it to be a very secondary thing to be followed because for them, their entire body was more important. So telling people that oral hygiene and oral health is equally important as your body health was a difficult task. And now I think people are changing their viewpoint, and they are more into oral hygiene and dental health now. Second misconception which we really faced was people thought that
to me, syringes even sound painful, and I'm astounded to know that there were treatments that were more painful, that could be more painful and time-consuming than syringes. I'm so amazed. Speaking of AI, now that you've mentioned it, has this AI affected the field of dentistry in any means?
Yeah, of course. Earlier we were using rotors, the micromotors, which were giving a lot of sound and anxiety to the patient. Now we have rotors which are working at a higher efficient speed and getting the work done very easily. Similarly, with the oral cameras and the ones where we don't need those long wires, easily portable ones, portable instruments, life has become easy not only for the dentist but also for the patients.
Do you acquiesce that in India or globally, dental procedures, dental surgeries are more costly than regular medical checkups? So,
yeah, I think so. For any dental procedure, whether it is a simple checkup also, we need an entire setup of the dental chair with the equipments required. So yeah, it is expensive, but in the long run, it is beneficial.
With the amount that the equipments cost, what is the difference between the amount of public and private clinics?
In public clinics or in government clinics, they do not look for any aesthetics.
Oh.
They are only going for all the procedures which are requiring just the basic treatment. So if a person goes to them asking for a filling, filling will cost them more, or a restoration will cost them more, so they will look for a easier option of just extracting the tooth.
Good morning to my lovely viewers. Today I'll be interviewing Dr. Swheta, a dentist, a medical specialist and a PGD teacher. Thank you for coming and joining me. I'm glad to have you as my interviewee.
Thank you, Vrinda. I'm very pleased that you gave me this opportunity, and I hope I will be able to answer all your queries.
Yes, everyone will learn a lot from you. The first question is, being a dental specialist, while practicing dentistry, what were a few of the misconceptions you came across that people had in regards to oral health? In your role, how did you address them and dealt with those?
Right. So the first and foremost was that people were not very careful about their oral health. They thought it to be a very secondary thing to be followed because for them, their entire body was more important. So telling people that oral hygiene and oral health is equally important as your body health was a difficult task. And now I think people are changing their viewpoint, and they are more into oral hygiene and dental health now. Second misconception which we really faced was people thought that extraction of a tooth, taking the tooth out, means that it will be affecting their eyes and their vision. So it was for a long time we had to deal with that, but now I think the searching on Google has given them this idea that no, it doesn't affect the vision at all. Also, another one, cleaning. Whenever we go for the scaling purposes and polishing of the teeth, that time also the people thought that it is going to make their teeth weak. So they were not getting them cleaned very often. But now I think it is changing with the passage of time. People are getting more aware about it.
I'm glad that's happening. I would have never known. The second question, specifically with children or old age people, as dentists, how do you reduce the dental anxiety that people face while tooth removal?
Right. So I think old people are also like children, so you have to deal with them very delicately. So whenever we have a child or a very old person coming to our clinic for an extraction, we generally don't do the procedure in the first go. We have to first make them very, very happy and make them their curiosity level or their suspicion about anything to a little lower level. So we have to reduce their anxiety. So in the first go, we never extract it. We will make them comfortable with the dental chair. We will make them aware why is it required, why you need to get them extracted, and probably it takes sometimes even more than one sitting also to make them little, comfortable. And I think once they're in the comfort zone talking to you and sitting on the dental chair and they have the confidence in you, then they go for the procedure easily.
Wow, that must be hard tasking.
Yes, I think doing the practical work is easier than counseling the patient is it takes a longer time. But I think that's part of our job.
During the procedure, how do you ensure the safety of the patient? Most people think that extracting a tooth, getting it removed, about just the equipment, pulling the tooth, and that's done. But what could possibly go wrong if you don't ensure the safety?
See, it's not about just pulling the tooth with a forceps. You need to be very precise. At times, you don't even use the forceps. You have to use just other equipments to just make the tooth loosen up in the socket and then remove it. So you have to be very careful while extraction. You can't just pull it out with the forceps. That's a very, very big misconception in people's mind. So it's a expertise of the dentist that you have to loosen it up and then pull it out.
Very informative. I feel like by interviewing you, I'm learning so much about this unbeknownst field.
I'm happy to share this. I'm totally excited about it.
With the advancement of tools and techniques in dentistry, how have they helped you make the procedure more patient-friendly and efficient?
Yes. Now, as we have been practicing for almost 23 years and we have been in this line for a long time, we have seen changes in the dentistry. Earlier, the procedures were more involved with where, it was difficult for us to control the pain. Now we've got syringes which are very, 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 very thin gauge, so it doesn't give a pain to the patient even while we are injecting the LA. Earlier we were doing the root canal treatment, which was considered to be a big painful therapy for most of the people, and we used to be using our instruments by just feeling it, tactile feelings. As we felt that it is going near the apex, we were feeling that. But now with the advancement in AI, we have things like apex locators, we have other things which are helping and really that giving us a time where patient can be very, very comfortable in the clinic.
Wow, to me, syringes even sound painful, and I'm astounded to know that there were treatments that were more painful, that could be more painful and time-consuming than syringes. I'm so amazed. Speaking of AI, now that you've mentioned it, has this AI affected the field of dentistry in any means?
Yeah, of course. Earlier we were using rotors, the micromotors, which were giving a lot of sound and anxiety to the patient. Now we have rotors which are working at a higher efficient speed and getting the work done very easily. Yes. Similarly, with the oral cameras and the ones where we don't need those long wires, easily portable ones, portable instruments, life has become easy not only for the dentist but also for the patients. So they can view everything what we are doing in front of them on the screen. And we also have a acuity, how deeper we are going into the tooth when we are working with the patients. So definitely AI has
I
brought.
must say, out of all the professionals, out of all the professions that I have interviewed, you are the first one saying that AI has made your life easier.
No, it
Because
is.
often people think that AI is replacing them.
See, AI cannot replace the professionals in terms of medical field. Even if you talk about any other field in medicine, eye surgeries or everywhere, we have to control the AI. So AI cannot control us. So even if we are using the apex locators instead of the reamers, traditional ones which we were using earlier, we need to have that feeling, we need to control them. So nobody can replace the professionals. I don't feel that.
Oh,
yeah, they
wow.
help us definitely, and we are happy to take their help, but they cannot replace them.
That's astounding. I would like to ask you, globally, in countries like the US, Canada, dentists tend to perform surgeries using a laughing gas on the patient. It is cost effective, it is safe, but we don't often see that in India. We don't see dentists doing that in India. I understand that it is said that the setup for that must be expensive, so
It is.
maybe not everyone can do that. However, is there a government angle to it that we are unbeknownst to?
Well, honestly, I don't know whether it is allowed here in India or not, but I do feel that laughing gas, you have to be very precise. You have to give the dosage in terms of the age of the person. You cannot exceed the limit because it's a chemical which is going inside the body of the patient. It can be harmful if it is beyond a certain limit. So there are lots of things you have to be careful about it, and I think with the number of patients we are dealing with them in India, we are very, very happy with the kind of way we are dealing with. We are using our LAs and they're working very well. With the nitrous oxide or the laughing gas, what I feel myself, maybe I'm not right in that context, but I think that a person should be aware when we are doing any dental procedure, and making them sleep through the procedure will not get the reactions from the patient. So whenever we are extracting a tooth, so in that case, sometimes we look at the pupil or the eyes of the patient and they give us the feeling that yeah, they're having the pain, even if they don't speak. Yeah, that gives us a precision. When nitrous oxide or if they're sleeping, we will not get that. So that's my personal view, which I feel maybe that.
Could you explain the process of nitrous dioxide, the laughing gas, to the viewers for viewer context? But whatever you told me, I can't imagine how you work.
We in dentistry in India, we are very lucky for any field, I would say, because we have more number of patients here. So we get to have different angles, different type of patients here, whereas I think in other countries, the number and the precision is not that good, as I feel.
All right. There is this misconception in India about flossing, that flossing can be harmful. The RD string is harmful. Do you think so? Because flossing is proven beneficial to remove the food from the teeth, the missed out food particles. What do you have to say about flossing?
Flossing is another misconception, as you said, a myth in people's mind that whenever we are using the floss, because floss is supposed to be used in areas which are in tight contact.
Yes.
So whenever you are passing that floss through the tight contact areas, people think that it will make your teeth loosen up or gaps between the teeth. That's not the case, because these flosses have been made in a way that they slide through your teeth and they help in removing any particle which is there in your mouth or in between the teeth. So yeah, you have to be very, very carefully talking to the patient and explaining them the benefits. They will not get to use it in one go. Again, as I said, you have to build in confidence with the patient and talk to them.
Do you acquiesce that in India or globally, dental procedures, dental surgeries are more costly than regular medical checkups? So,
yeah, I think so, because our equipments are very costly. So if a medical professional has to talk to a patient and check for any diagnosis. You just have to talk to them. You need a setup which is very simple. For any dental procedure, whether it is a simple checkup also, we need an entire setup of the dental chair with the equipments required. So yeah, it is expensive, but in the long run, it is beneficial.
With the amount that the equipments cost, what is the difference between the amount of public and private clinics?
In public clinics or in government clinics, they do not look for any aesthetics.
Oh.
They are only going for all the procedures which are requiring just the basic treatment. So if a person goes to them asking for a filling, filling will cost them more, so, or a restoration will cost them more, so they will look for a easier option of just extracting the tooth. Whereas in private clinic, we are more concerned with aesthetics and restorations. So we try to save the tooth even if it is in the worst condition.
Wow, that's so
because
honorable.
that costs.
That's
so.
honorable. Would you bust this myth? In India or in foreign countries, do government actually fund dentists?
In other countries, yes, it is covered under medical insurance, but not in our country.
Oh.
It is yet to be considered as a part of their, because as I told you, they are not considering oral health to be as important as the other areas of your body. So yeah, I think government also needs to be aware of it.
Yes. Do you agree, as you said, that the work that you do is more about beautification these days than oral health? People tend to care more about aesthetics and how white their teeth are.
Yeah, but honestly, yes, for us, definitely the health comes first, and the aesthetic part is a secondary one. Because to be very honest, in our clinic, we will give them the option, and we'll give them the right way of telling them that this is mandatory for you and this is optional. So if they want to restore their front teeth just for aesthetic purposes, we'll tell them this is not mandatory, but if you want to go for it just for the look purpose or aesthetics, definitely then
okay, specifically with old people or people who need this early on in life, the aesthetics, the whitened teeth to look perfect. Well, now the impact of media has made it a mindset that aesthetics do matter. How do you ensure that you are doing what they want you to do, making their teeth look beautiful, but also so that they function?
See, you just can't, you are perfect as you're born. I believe in that concept.
Yeah.
So I don't believe in getting the perfection. So you're born perfect. That's your way of looking at you. So if a person comes to us to look perfect, we will tell them that this is kind of look you have, and the changes which are mandatory again has to be done. The optional one, we tell them, okay, if supposedly they want whitening. Whitening is a procedure where you have to remove the outermost layer of the tooth, which is very, very important, right?
Yeah.
So, and that's a protective layer. So we tell them the harmful effects of it. Even if they want to get it done, then we just make them aware of it. Even after that, if they want to get into perfection, that's their way of looking at it.
Are there any budget alternatives people can take for dental procedures?
As you only said that government funding government hospitals are cheaper.
Yeah.
Because they don't go in for anything which is requiring expensive procedure, not even the fillings. So they were always into extraction. So yeah, that's a cheaper alternative for them. But in our clinic also, if it is somebody who is really in trouble and they can't pay, so we do consider that.
And that is all that I would ask. That was a very informative session. Thank you for being here.
Thank you for interviewing, and I think I was able to justify all the questions which you asked.
Yes, you did. People would learn a ton from these because people often take the dental profession or getting dental surgery lightly. But what you explained to them, it just shows how much work you put in, how much value is going into that work to assure everyone's safety and basic requirements, and that's honorable.
Thank you so much. I just want to culminate it by saying you should love your work.
Yes.
If you love your work, you'll be able to justify anything you do.
True.
Yeah. Thank you so much.
Thank you.